In the meantime, however, no one has been able to prove that the official theory is the correct one, and that the origin of cancer is in fact of genetic nature.
Major advances are being made in the detection, prevention, and treatment of cancer. But the mechanisms that trigger malignant cell growth are still not completely understood.
In the meantime, statistics seem only to get worse.
We've lost the war on cancer. Since the 1950s, the outlook for most cancer patients has remained the same, a 1 in 3 chance of living for 5 years after diagnosis using conventional therapies, surgery, radiation, chemotherapy, drugs. The fact is that today, 2 out of 3 American cancer patients will be dead before 5 years.
Despite such dismal results, official oncology continues to impose on patients the only 3 therapies that have ever been authorized in the last 100 years: surgery, chemotherapy, and radiotherapy. And 2 of the 3 are actually carcinogenic.
Surgery is the oldest technique and the most successful of the 3. But surgery is useful only when the cancer is localized, a minority of cases. Patients also fear radiation's dangerous side effects. One of these is that radiation can actually cause cancer. The use of radiation remains controversial even in medical circles.
As much as we could work with her, say on a math problem, she was not comprehending it.
It would take a long time to get like a worksheet done.
Parts of Elizabeth's brain weren't there anymore because of the radiation, that it had killed that part of the brain. So the part of the brain that was responsible for memory was gone.
Chemotherapy is designed to kill cancer cells throughout the body. It is highly toxic, however, and it also kills healthy cells. Today, chemotherapy is often given in combination with surgery and radiation.
Your typical chemotherapy agent will certainly cause tiredness. There is a risk of sickness, but there are very good anti-sickness drugs these days that can control that. Chemotherapy frequently causes taste change. It can cause a sore mouth. The first side effect that many people ask about, however, is hair loss.
In fact, many chemotherapy drugs are carcinogenic. Their toxicity is so high that all personnel handling them must observe very strict safety rules. Their disposal calls for total destruction and incineration of anything that comes in contact with them. Some of these drugs remain partially toxic even after incineration beyond 1800 degrees Fahrenheit.